on February 28th, 2010? Do you remember? I remember exactly where I was. I was sitting at home in my family room in my particular brown chair, and just this far away was my son Jack, and just that far away from him was my son Ben. And milling about in our family room kitchen area was my wife Sandra and my beautiful daughter Julia. And it was a special day because that was the day that Sidney Crosby took a pass from the left and instantly shot it into the goal, and in that second captured, in overtime, the Olympic gold medal for Canada against our arch rivals, the USA. It was a great day. We were ecstatic, not just for the event, but to be together as a family. But you see, I can't look back on that day with the joy that I had in the moment, because that was the day, that was the last day I saw my son Jack. That was the last day I held him in my arms, that I told him that I loved him, and that he whispered back, "I love you too, Dad." Just saying the name, just saying Jack's name brings back a flood of memories. Inseparable from Ben, especially in the early years. They grew up together in many ways as best friends. I remember the first time Jack came home after he had his adult teeth. He had been at his friend Jack C's. You see, when Jack grew up, his best friend was Jack C, and he was Jack W. They were both blonde, good-looking boys, so that's how the teachers told them apart. And Jack arrived home and he had a big towel over his mouth. You'd see there'd been a playground incident. And somehow, our Jack got tangled up as he was going down the slide with the swing set rope, and it pulled up over and it yanked his brand new, beautiful big tooth. And it was pointing straight out of his mouth. It was hanging by a thread. And I remember he said, before we could take him to the clinic, "I need to look at it." So we brought a little mirror out to the car, and he held it up. And I remember him saying, "You can't leave it like that." And off to the clinic we met. We lived in Chicago for a few years, and the first year we got there was probably Jack's last year going out for Halloween. So here in Blackhawks land was Jack in full Maple Leafs regalia, with blue hair, the Leafs jersey, and somehow a puck stuck to his forehead. I remember that day. Jack was never far from a book. He read like magic. He just learned by magic and always read like magic. He was also a trivia buff. And if Sandra and Jack were on a team together, they could beat all comers. I remember we were traveling and someone said, "Can you say the alphabet backwards?" And of course I said, "Not a chance, not if I practiced." And he just put his hands to his head and he said the alphabet at a normal pace backwards. He had an unusually incredible brain. Maybe he had some neuroplasticity that we heard about from Diana today. So I remember things like that about Jack. I remember Sandra and I, throughout high school when Jack was rowing, it was freezing cold, and he was the lightest guy on the team, usually at the front of the boat. But the coaches always said he always shows up and he always pulls his weight. So 4 weeks later, after February 28th, 2010, I got a call from a police officer. It was a Saturday morning. I picked up the phone, and he told us. He didn't ask us. He told us he was coming to the house. Sandra and I flew into a panic because, you see, everybody was accounted for except Jack. The police officer pulled up in his squad car 3 minutes later. We didn't even want to let him in the house, but he had to come in the house, and as quick as I'm telling you, he told us that Jack had been found, he had passed away, and it was suicide. the cluster bomb went off in my mind and throughout our household, and we collapsed, now as a family of 4 in the chair that every morning I read the newspaper in. So a few weeks later, after the cloud just starts to part a tiny little bit, we started to cope. And the way I started to cope was I had to find out how this was possible. How this family that's so fortunate and lucky and happy and seemingly healthy, how this could change in an instant. And so I started asking questions. I called every mental health professional I could find, and they answered my calls, and I visited with them. I went to Jack's high school, and I came here to Jack's University. I talked to the administration, I talked to the deans, and I talked to the principal. But most importantly, I talked to the students. I talked to the students who knew Jack and many more who didn't know Jack. And I started learning things, and then one thing led to another, and we started something called the Jack Project. And we raised some money. We partnered with an organization called Kids Help Phone, Canada's leading youth crisis phone service. And we started doing outreach sessions to thousands of parents, educators, and students all across this province. But what was really interesting over the last couple of years is as we shared our story, the amount of people that engaged with the story has never ceased to amaze me. People started organizing bike rides, running groups who ran marathons and raised money for us. People started engaging in the topic of mental health and suicide and started talking about it just like it was another subject. One person actually carried a banner, which I now call the Jack flag, to the top of Kilimanjaro with their family. That same banner traveled to Mount Everest and went up to base camp. Another way that we can share and capture the story. But what else did I learn over this last 2.5 years? I learned about the inextricable link between mental health and suicide. You can't have the conversation about suicide without talking about mental health. And I learned about the numbers, which I think frame this subject so well. I'll share a few of them with you today. 500 million is the first number. That's the number of people on this planet right now, today, that are suffering from a diagnosable level mental health challenge. 1 million is the next number. That's the number of people who are lost to suicide each year around the world. 90% of them are related to a mental health challenge. 30,000 is the number of people living in the United States that are lost every single year to suicide. When those planes, hijacked by terrorists, crashed into the towers in New York and brought them to the ground, a global incident beyond imagination, 2,900 people died. 10 times that amount of people die every year in the United States by suicide. In Canada, bringing the story to home, it's 4,000 people. If you lined up the caskets end to end to end to end in Canada, it would be 5 miles long. 10 per day. Cluster bombs going off in families like ours and radiating out to the community, to the schools, and in some cases beyond. Just while I'm talking here today, 25 people around the world will die by suicide. But if there's one number that I'd like you to remember, it's the number 1, because this topic of mental health and suicide is the number 1 biggest health risk for our young people and the number 1 health-related cause of death for our young people is suicide. And so as far as I'm concerned, if it's the number 1 health concern for young people, it should be our number 1 health concern. A recent study came out in this area where we all live, calculating that the mental health impact is 1.5 times greater than all cancers combined. But what else did I learn in this last 2.5 years? I learned just how hard it is to talk about this subject. Jack couldn't talk about it. Many of us have trouble talking about it. And it's this suffocating quicksand of stigma that's inside us all and around us all that prevents us from talking about this subject. But we know, Sandra and I, Ben and Julia know oh too well, that the alternative to talking about it, the alternative of silence, is completely unacceptable. And I'm convinced that if somewhere in Jack's upbringing he had been informed about mental health and suicide, if we as a family had been informed about it, if the people around Jack at university had been informed about it as they are being informed now, that he would still be here today. And there are many Jacks out there that's all it would take is some information and the ability to talk about it. So how do we all engage and learn to save a life? You don't all have time to do this like I do. You don't have time to go and take a mental health first aid course or suicide prevention training. But you can listen for a moment here today. And the circle around this idea of saving a life starts with you and those people who are in your contact circle. The people you're around every day, starting with your family, and perhaps if you're away at school, it's your friends, the people you live in a house off campus or on your residence floor with, the people in your class that you really associate with. If you're a prof, it's those students that you spend time with, or if you're a TA, perhaps it's the students in your tutorial group. But if you're willing to observe changes in behavior in that circle of people around you, and you're in the best position to do that, starting with your best friend and all those people around you, because you see changes in behavior, if they are prolonged and if they're significant, things like changes in eating and in sleeping, rapid weight loss, weight gain, attendance at class, irritability, all these sorts of things. You need to trust your gut because they could very well be a sign of mental health distress. So that's the number one thing you need to think about in order to help save a life. And the number two thing is that if somebody is exhibiting changes that don't feel right to you in your gut, it could be an indication that that person is suicidal. And this is where it gets hard, because you have to be prepared to find that time, to steel yourself, to ask the question, are you considering hurting yourself? Are you considering suicide? And depending on what you hear back, if you're worried, you need to be prepared to support that person to the best of your ability. Not to become their counselor, not to become their doctor, and you may need other people to help you support, but you need to be prepared to support them. And you need to be willing to do what it takes to stay with them as long as it takes until you can get them to a trusted adult, to a professional, to a counselor on campus, or in the most emergent cases, you need to take them to the hospital or call 911. You need to be prepared to do those things, those two simple things, and you can actually help save a life. As we've shared Jack's stories, it's never ceased to amaze me how we hear stories back. And this story from this young student was one of the first stories that I heard, and it's always one that I think back to that gives me, I guess, the courage to keep doing this, to keep telling Jack's story. Jack's story continues to have an enormous impact on my life by the very fact that I'm still here today. Just hearing Jack's story gave this person the courage to reach out for help. I'm not comfortable with this idea of being a pioneer. Quite frankly, Deanna and this incredible work she's doing linking music and neuroplasticity of the mind, and Leslie, the innovator in healthcare, those are pioneers. The only thing I'm comfortable with when I looked up all the definitions is being a foot soldier. A foot soldier perhaps a little bit ahead of the main army, because that's what we need. We need an army that looks like you and like you and like you. An army of young people that are willing to engage in this topic of mental health and suicide and make it part of the everyday conversation. On this campus, this is what this army looks like. And the campus youth are starting to engage in this topic, and we'll try to do whatever we can to help them spread it to other campuses and across this nation. So if you're willing to somehow join this army in some small way, and maybe it just says you came here to TEDxQueensU today and you heard a talk. Maybe it's talking when you go home and you're with your parents or with your roommates and you talk about the subject of how you're feeling or how they may be feeling. Maybe you'll be involved in an event. And if you're prepared to remember those two things I told you about, watch for changes in behavior, and if you see changes in behavior, be prepared to talk to somebody about it and ask them if they may be suicidal. Then you can help save a life, and the life you save may be your own.
I love you. Let somebody save your life.